Welcome back to the Academy Table. I'm Renee De Silva, CEO of the Academy and your host, and we're happy to have you back with us again. I'm excited to share this conversation with Florian Otto, the co-founder and CEO of Cedar. Cedar, as you may know, is a healthcare technology company working to transform the financial and billing experience for patients and providers. As you'll soon hear, Florian is originally from Germany and was first trained as a dentist. As a true outsider to American healthcare, I loved his thoughts and, by extension, Cedar's approach to solving the uniquely American challenge of paying for healthcare. A few other takeaways that I'd like to bring to your attention. First, listen for how he articulates the lingering problems on price transparency as one of communication and engagement, not lack of data or interest. Next, Florian shared his insights on digital empathy and compassionate design. He shares some simple ways that providers and really all of us can make the mundane feel more customized and heartfelt. And finally, I enjoyed hearing Florian's thoughts on entrepreneurship and building a company. I've been struck by his deep mission orientation and also his willingness to be authentic and speak out on important issues. So with that, let's head to the table. Florian, thank you so much for joining us today at the Academy Table. Delighted to have you.
Thanks for having me, Renee.
So I want to just jump in. One of the things that I'm struck by in your background is just the international background that I know has shaped maybe how you think about your career and your understanding of the U.S. healthcare system. Talk a little bit more about that specifically.
Yes, sure. Very happy to talk about that. So just for the audience, so I grew up in Germany. So I'm used basically the first 30 years of my life with the German healthcare model. Then lived in Brazil for 5 years, and right now for around 8 years already in the United States. So in Germany, of course, has kind of the healthcare system has shaped me quite a bit. That literally the medical experience is extremely important, and the financial experience is completely irrelevant because everything is being taken care of and you don't need to pay anything for healthcare. So it's a very interesting model in Germany, where I think the difference between rich and poor doesn't get any difference in the healthcare experience, which I think is actually one of the important things that a healthcare system should be. And there are, I would say, very little waiting time. So when you look on the quality of the healthcare system, I think it is pretty good because it's very good on equity. I think it's very good on access. I think the average quality is pretty fine, and waiting times are not too high. It is not the most efficient healthcare system in the world, as of course in most of the developed countries. Still pretty expensive, not maybe as inefficient as the US, but still it is an expensive healthcare system.
It's interesting. I imagine you still have some family that's still in Germany. Is that right?
I do, yes.
I wonder, how do you describe Cedar to them, especially given what you mentioned, their maybe context is that there is not necessarily a financial experience attached to healthcare. So what's your short maybe storyline to your family on Cedar and what problem you're solving here?
Yeah, it's a very good question, and you're totally right. It's very difficult to explain that to somebody in Germany. So you basically literally need to explain as it is you're going shopping, but without the transparency. And I think that's the fundamental problem. Nobody has any problems that the consumer needs to pay for something, but you need to pay for something that you understand, where you understand the value, you know it before something happens. And neither of those things really happen, I think, here in the healthcare payments.
Yes, even for those of us who have spent our career in healthcare and consider ourselves to be informed consumers of healthcare, when you are at the point of needing care, it can still be hard for those of us who have the experience to navigate it. And I know that part of what the vision for Cedar was born out of was an experience that I believe at the time your fiance had with healthcare. Talk a little bit about how you drew that, or how you drew inspiration from that experience.
Sure, happy to talk about that. So my wife, back in, I think it was 2015, she fainted here on the street right in New York and needed to go to the ER, and then swiped credit card for the copayment. We thought everything was done. And then a month later, she got some statements, literally a stack of papers, everything in CPT codes, didn't really understand it and needed to call in order to pay it. And then a month later, she got the invoice from the imaging center. And then half a year later, a debt collector called her for a bill that she never received from the lab company. So it was a really bad experience for her. And she said, never take me ever back to that healthcare system, because she lost the trust in the system. She said, okay, the administrative team was so organized, then she's really worried about the medical quality. And it kind of makes sense, right? Because as you probably know, trust is consistency over time. And if it's not consistent experience from the beginning to the end, then you're losing trust in the healthcare system.
That's right. And I think, I know that Cedar has done a lot of survey work around this, and I also think that the COVID experience, in some ways, providers are right now maybe experiencing higher satisfaction and deeper respect than maybe even a couple of years ago. But I think your point is that the care quality and the passion of the nurses and doctors come through, and you may be at a high point in that experience. And then on the back end, all the administrative touch points, either pre or post service, is where there's a lot of tension. And I know that that's a big part of what you're really trying to focus on.
I 100% agree with you. And I think the medical quality, especially the average one in the US, is probably increasing every single year. And most of the healthcare systems, they were doing a lot of advertising in the last 20 or 30 years with, we have the best doctors, we have the best nurses. And I think this became table stakes. And especially for, let's call it 80 or 90% of the doctor visits, I think the experience or the administrative side and the convenience becomes more and more important. So right now, I think if you really want to have a good entire healthcare experience, you need to have a good medical experience and also a good digital experience.
So I want to unpack that a bit more, but let's just talk about this notion of price transparency. I think there's an issue where there is universal agreement from providers, from payers, from vendors in the space and partners that it's a problem, but really small or incremental progress on the solution. I wonder how your own view of it has evolved since launching Cedar 5 years ago. And then maybe as a follow-on question would be, when you look at folks that you work with that are getting this part of it right, just what maybe comes to mind for you? So how has your understanding evolved over the last 5 years on price transparency and ways to solve it?
Yeah, I think definitely what changed to me was that in the beginning, my understanding was that nobody really wants to show prices. Neither the providers nor the payers, nobody really wanted to show prices. And in the end, the patients were suffering from that. And that changed over time, my perception of that. Talking to a lot of healthcare leaders on the provider side and even some payers, they really want that it's clear for the patient, because patients right now, if they don't know their prices before, or if they think that the prices were not right, they're actually very frustrated. Patient satisfaction goes down. They don't want to come back to the doctor. So they're missing some preventive procedures or some preventive exams. Bad for the health plans. It's bad for the healthcare system. So overall, I strongly believe the problem is not necessarily that they don't want it. I think that there's a big technology problem. And right now, you might have the chances to somehow get the prices for something, but it's extremely cumbersome for the patients to do that. So that's one of the reasons why I think the problem is not necessarily the willingness, but it's just literally the ability with the current technology infrastructure.
I think that's right. And then I think it does go back to our first question around, if any of us were taking a blank sheet and designing the healthcare experience, it would look very different. And I think part of what makes it hard to have clarity around pricing is we operate with a cross subsidy in terms of commercial subsidizing government payers. And I think there's a reckoning to be had around how do we think about affordability in the context of that, right? Of how do I run this health system efficiently, and then how am I able to do that in terms of the overall cost of care? And so it'll be interesting to see as an industry how we reconcile with the affordability issue and the cross subsidy economics that sometimes I think create some of this black box around pricing.
Yeah, I think you're 100% right. And it's of course on both sides, right? The first question is, okay, how does the healthcare system get funded? And when you compare, for example, the German system with the American system, it's extremely different. The U.S. healthcare system is one of the I think the only healthcare systems in the world of at least the G8 that is linked somehow the healthcare funding through the employer, at least on the private side, right? And I think the second piece, which is very interesting, that healthcare somehow should not, because the what healthcare costs for the poor and for the rich is exactly the same. So I think the funding should also be a bit more equitable. But with equitable, I mean not the same for everyone, but the same percentage of the salary for everyone. And that's how the German system is also getting the funding. It's a certain percentage of your salary. And that, of course, makes everything a little bit more fair. Higher income individuals pay a little bit more than lower income individuals. And it's not linked to literally which healthcare plan right now is offered by your employer.
Interesting. One of the questions that I've been spending some time on with our CEOs that I talk to is this notion of if we were to look out 10 years and write a headline on what healthcare delivery or funding or reimbursement looks like with a, call it Horizon 2030 aperture, what would those headlines be? I wonder if you were in that, let me ask you that question. If you were writing a headline in terms of what we might expect in this space of transparency, equity on funding, what do you think the headline might be? If you were optimistic.
I am 100% optimistic. No question on that. So let's maybe address the thing that is actually one of the most important thing, and that doesn't have nothing to do with just the out of pocket or so what Cedar is addressing. But I think the biggest problem right now on the US healthcare system is that you have a lot of non-insured. You still have them, or completely uninsured. And what I strongly believe that in 10 or 20 years, we'll look back and we will say, oh my God, were we terrible that not every single one of our fellow citizens had an insurance. And I think that's really where we need to get to have 100% of the Americans insured, and nobody should go into bankruptcy because of a health issue.
I share your optimism. I'm also buoyed by, if you look out or if you look back in terms of things even 20, 30 years ago that didn't feel possible, I think as a country, we typically get on the right side of things, even if it takes us quite some time. So I'm with you on that as well. I want to just stay on this current state for a moment. And so when you think about exemplars, those partners that you work with that have been able to use, and I've heard you talk about this, some of the CMS price transparency rules, have been able to harness that for competitive advantage. What comes to mind for you as to what those health systems have figured out that maybe their peers could learn from?
Sure. Happy to talk a bit about that. So I think overall, the price transparency is much more of a communication problem than a real data problem. Of course, sometimes it is a data problem as well. If you just get admitted to the emergency room and you don't know what will be done with you, nobody will ever be able to tell you before what something cost. But if it's right now a standard procedure, you can find it out. But the big problem is it's extremely cumbersome to find out. You're probably for half an hour on the phone. You might need to call your insurance company in between. Where are you in your deductible? And then you need to call the healthcare system back. And probably nobody really does that. So it's not very digestible for the consumer. And I strongly believe that if it's easy for the consumer to review that and they have that on their finger point on, for example, an app or in a very easy to use web interface, then all of a sudden it becomes a huge competitive advantage. Because not one single healthcare system wants to surprise the patient after the visit with any price. Nobody wants that, because that decreases the patient satisfaction, causes frustration, and in the end, all these complaints, they land into in the online portals, Yelp or Google reviews, or as complaint letters on the CEO's desk. So I strongly believe that healthcare systems want the transparency, but it's just very, very difficult to execute.
I think that's right. And you are continuing to try to bring the digitizing the process, having more of a seamless interaction, so it feels less transactional. I know that in May you announced the acquisition of Uda Health. Do you see that as a key part of the ability to make that happen?
Yes, absolutely. We are extremely excited about the acquisition of Uda Health. So Cedar, before the acquisition of Uda, was improving the entire billing and financial experience between the patient and the healthcare system, so the provider. And we have made great strides there from going from the post-visit experience to the pre-visit experience, not only dealing with paying, but also doing denials messaging, doing charity care application, doing a lot of other workflows that reduces the burden for the patient around the visit. So that was basically what we were doing, and we had great success with that. However, there's also, in terms of the healthcare experience, there's a very big difference because they are still getting all these explanation of benefits from the payer. And so many patients right now needing to deal with either the payer or the provider and don't understand what is going on there. So the integration of the payer side really solves this problem from the beginning on. Because it's not only about getting the explanation of benefits, but it's also, for example, prior authorization. Uda has a very interesting product, which is called Uda Optics, which is a prior authorization product. And that really, of course, helps for the consumer as well to really understand before the visit whether they get authorized or not. And then after the visit, the integration of all the explanation of benefits into the bill, all of a sudden it makes sense. Because in the beginning, you probably know this, the time on when you get the EOB or the patient bill from the provider is usually very disjoint. The codes don't really match up with each other. I think in 40% of the cases, the explanation of benefits is not matching the provider bill. And that, of course, is extremely low. And all of these things, they erode the trust into the entire healthcare system. And with entire healthcare system, I literally mean the payer and the provider, because the average consumer cannot really understand what is the difference between both of them. And very often, the problem is on both sides, right?
That's right. That's right. There's a ton of power in that, just in terms of bringing to healthcare the digital experience that we expect out of every other facet of our day-to-day lives, whether that's buying an airplane ticket or booking a hotel or ordering from Amazon. And just there's so much power in that. And I think you are right in that. I think providers are aligned around wanting that, and the patient experience broadly, I think, would have a really positive impact on that front and back end cohesion. So I think that's great. I wish you the best with that integration.
Thank you. Yeah, I think the objective is literally to put the patient in the center of everything, and that is between the provider and the payer. And most important is that the patient really can focus on getting healthy and not needing to worry with all this administrative hassle that, of course, is extremely painful in the period when you need to most focus on getting healthy again.
That's right. And on that exact point, I've appreciated some of the sentiments you've shared on compassionate technology and putting the consumer at the center of every healthcare interaction, particularly billing. Can you talk more about that?
Yes, I'm really excited about the opportunities that technology can do for the consumers to be put into the center. And it's a few things. When you look on what is the old technology doing, especially on the billing experience, they're literally sending the same statements after 30, 60, 90 days to the patients. They probably don't understand it, and it goes to collections, and then credit scores get dinged. That's definitely not very compassionate. That's definitely not very personalized. And that's a big gap to what the consumer is facing in these other on-demand technologies, like you mentioned, the Uber, Amazon, Expedia, Netflix, and so on. All of those technologies, they are very personalized. They're very immediate. They're very transparent, and they are, of course, fair. And that's what this compassionate billing is all about. And of course, what the core value of Cedar is about. So what does that mean? So when, for example, COVID hit, we knew that a lot of patients are right now in a hardship. So we can, with our technology, change the messaging literally from one day to the other to give patients either more time to pay. So we called every single one of our clients, and they were very, very open to that, to extend, for example, payment plans. Just stopped sending people into collections, extending the dunning cycles, which we really, really appreciated. Other things on the compassionate billing, we, for example, reduced the frequency on how we reach out to patients. Had a very positive impact on what patient appreciated. And of course, literally just reaching the patients on where they are, because it's not necessarily only the ability to pay of the patients is the problem, but also just the convenience and the location. And as you probably already know this, a lot of patients right now are not at their home anymore. They're going to their parents, they're going to other locations. So reaching them of where they are with a more modern digital technology reduces the friction and increases, of course, the patients that they feel heard as an individual.
That's fantastic. When you look across I think you work with 40 health systems, 40 providers across the country. Do you note, because some of this to me feels somewhat intuitive, but not at all how we've been wired as a provider landscape necessarily. So are you noting that conversations with CFOs and heads of revenue cycle are moving more naturally in this direction? Are you having to sort of push and prompt on this notion of compassionate billing and compassionate technology? I'm just wondering where you're finding leaders on this spectrum of a much more evolved, personalized experience around patient finances.
Yeah, absolutely. So it depends on, so overall, let's call it the healthcare system and the CFO and maybe some other leaders that might be more on patient experience or chief innovation officers. Overall, everybody really agrees with that. The CFO, of course, especially in this time where a lot of healthcare systems are strained by the financial results, might be in the beginning a little bit more skeptical to really understand, okay, what does that mean to the bottom line of the healthcare system? Because a lot of healthcare systems are, of course, financially strained right now. So having another drop in revenue somewhere would not be good for them. The interesting piece is when we really explain to what is the underlying mechanics of that and the results of that, and that the interesting piece is when the patient satisfaction is going up, also the payments are going up. So it's not that this is a zero-sum game. And reducing the friction means a higher patient satisfaction, a higher collection rate, a lower time to collect, and a lower cost to collect. So overall, the CFO is totally excited about this. On the other side, of course, the marketing executives or the patient experience executives or chief innovation officers, they, of course, also are very excited about this because it positions the healthcare system to the next level.
That's right. And I do think as healthcare systems themselves even contemplate delivering care more virtually and what that means. I mean, I think those that are ruthlessly focused on the consumer experience from front to back will be winners. And so it sounds like this is a important way to think about that virtuous circle of growing through delivering great service and making sure that doesn't stop when you are no longer in front of your physician. So I think that's really powerful. I do want to change gears a bit. I'm privileged, given my role at the Academy, to study CEOs across the broader healthcare landscape and how they show up. And one of the things that I noted about you and how you show up as a leader is your comfort and commitment to using your own voice and maybe by extension, Cedar's platform to speak on issues that you care about. So I wonder, has that always been in your DNA? Has that been something that over time you've had to get more comfortable with? But how do you think about where and when and how you weigh in on important social issues?
Yeah, that's definitely something I'm very, very passionate about when building a company. And I think maybe a step back on why did I start Cedar? Because I really saw a big problem and a big opportunity to improve the healthcare system in the US. And that's definitely my only mission. And how do I do that? I basically do this by creating a company where we have a lot of co-workers that are really doing all of the work on getting us there, excited about striving towards a common vision. And in order to have this vision, the company also needs to be very clear where it stands for and where does it not stand for. And if you're right now a leader that just basically tries to be very political and always tries to do something that is the most popular opinion, I think you might not be the most trusted leader in the long run. And I rather try not to bend myself over to something that I don't think is really Florian, the founder and CEO of Cedar. I rather say what I truly believe is the right thing to do. And of course, some people really like it, and some people also might not like it. But I think having an opinion and being very clear with this is extremely important, because I'm totally fine if people don't agree with my opinion. I still might respect them absolutely as human beings. I respect their opinion, but it might be very, very different from me, and they might not be that excited about Cedar. I accept that. But on the other side, people that are aligned with my views, with my mission, with Cedar's vision on where we are going, they are, of course, very, very excited to be part of this movement and trying to improve the world a little bit.
I think a couple of things that you said that landed with me. The first is just that really drawing from your own sense of authenticity, just speaking to what you truly believe. And so don't you pick the issues, don't let the issues pick you. That's been a guiding force for me. It sounds like you're equally aligned on that. Just I may not necessarily have an opinion on everything. I may not be informed in everything, but just really picking my moments, I think, is a big part of showing up and just sort of being who you are. I love how you said that. I do wonder on the not everybody will agree piece of it. Do you think that as a co-founder, you perhaps have a bit more latitude in that than maybe a publicly traded or a company that is run by a non-founder CEO? So in some ways, you created Cedar. Do you think that gives you more agency than it would any other CEO in terms of being okay when maybe there are some folks that are not aligned with your vision or your philosophy?
I agree partially with this, but let's maybe unwrap that. So I think for me, it's a bit easier because I started the company from scratch. So that means that, of course, the people I hire from the beginning on that joined Cedar, we, of course, are aligned with a certain vision. That makes it easier. If I right now joined a company that is definitely not aligned with my vision, and I would try to be very vocal about my vision, I would, of course, speak against the current team members, and that would not be good. So in that phase, I think it's definitely much easier for me. On the other side, I think hiding behind something to speaking up because maybe the shareholders don't like that or somebody else doesn't like it, I think it's a very bad excuse. Because, I mean, if somebody tells you to do something you're not convinced about, you should not do it. We are all free human beings here. And I think we have the freedom of speech. We should definitely say that. So I'm very passionate that everybody should say what they think is right. They should stick for their values. But of course, it's a little bit tougher. I think if you join a company and maybe not 100% is aligned with that, maybe your predecessor was not doing it in such a strong way. But I don't think that the CEOs should worry because of the board or the shareholders. I think it's more the team members.
Yeah, I love that you made that distinction. I've been in some of my CEO conversations talk about how leaders are, maybe I'll frame it as having to lead from the middle. So they are running large organizations across different geographical boundaries. In some ways, as a country, we've never had more polarized views on both spectrums. And so I do think it can be a challenge for people who are, in particular, I'm talking about health system leaders, to figure out how to thread that needle and speak in a way where you're inviting people in versus calling anybody out and having your view and having your values and your convictions, but leaving space at the table for other views as well. And trying to do that well has been really interesting for me to watch how many of our leaders are navigating that. So you're right. It does come down to your team members and the community in which you operate and trying to create space broadly for all.
100% agreed. And by the way, all of this being very aligned on the vision or the mission doesn't mean at all that we don't have a diverse team with diverse background of people, with diverse problem-solving skills, with diverse opinions on certain issues. No question at all. We are extremely diverse group, but we are all looking in the same direction. And there are, of course, a certain set of values. If something is against our values, we are all, as a company, speak up on that. Otherwise, we are a non-political organization and we really appreciate talking to any side of the spectrum. And you know that I also have a podcast series. We have Republicans there, we have Democrats there, we have anybody who really wants to somehow improve the political or the healthcare system in the country. We appreciate the opinion.
Absolutely. I love that. For me, I will say it's been a little bit of an evolution around really being comfortable using my voice and speaking out. And I do draw inspiration. And Florian, if I were to be honest about that, I do think some of that comes from an awareness for me of often being either the only woman in the room or the only person of color in the room, and not necessarily wanting to be the only one that's speaking truth to some issues that impacts portions of our society more profoundly than others. And so I really do appreciate when leaders like yourself are actively working as an ally and creating more of this candid conversations in public settings. It really does go a long way. So I do appreciate your voice on that for sure.
Yeah, and we of course cannot change everything, but the only thing we can guarantee that we stand up for what we think is right. I mean, even personally, I cannot even vote in the United States because I'm an immigrant. So I'm definitely officially probably the least political person in the country. But at least I want to speak up for what I think is right.
Really powerful. All right, I have one final question for you, and that is, we launched this season 2 of the podcast. We're calling it the Academy Table, and that's just if we think about where a lot of us get our joy, it's around the table with people that we care about, sharing a good meal. So if you were curating your ideal table and you could invite any 2 people for a conversation, who would they be and why?
Oh, wow. That's a great question. Since we're in healthcare, so it's maybe, I think, 2 individuals, one more from entrepreneurship, who I absolutely admire, and one more from healthcare. So let's go maybe with a healthcare leader first, and it's Uwe Reinhardt. Is his name, who was a professor at Princeton. I think one of the most thoughtful healthcare economists. Love reading his books, really, really deep analysis on what drives healthcare, what drives the cost. Can definitely recommend all of his readings. Would love to have a discussion with him about what he thinks are the best ways to improve the healthcare system from an economic perspective. Really love that. And the second person from an entrepreneurial perspective who I'm absolutely passionate about is Sam Walton, founder of Walmart. I just think on how he built up something from the beginning on, from very easy means, the passion that he put into the business, the level of cohesion from the beginning to the end, and how he was leading the company, how he interacted with his staff, and how he ultimately achieved his vision of serving the rural areas and with great products at a fair price was absolutely, I think, fantastic. So both of those people at a table, I would be thrilled to have them.
That would be a delightful conversation. Well, Florian, thank you for the time. I hope to see you at some point in person in 2021, but always grateful for spending some time with you. And thank you so much for joining us today.
Thanks a lot for all you're doing.
Thanks again for joining me at The Table. The Table is a podcast produced by the Health Management Academy. Make sure you catch future episodes by visiting our website, theacademytable.com, or by subscribing on the podcast platform of your choice. And if you have suggestions for topics or guests, I'd love to hear from you. Please drop me a note at renee@hmacademy.com. I look forward to talking with you soon.